I want you to imagine you found out your heart, the very organ keeping you alive, was failing you. And what if you were in your early 20s with a full life ahead of yourself? And now you're told that you need a new heart to survive? Then the clock starts ticking. Today on the Health Exchange, we're joined by Russell Redwood, who went through this life-altering experience. I want to thank you for joining us. I'm Dr. J. Rutland, and in addition to Russell, I'm excited to introduce Dr. Danielle Belardo, a preventive cardiologist with a focus on the intersection of cardiovascular disease prevention, cardiometabolic health, obesity, and nutrition. She helped out my uncle, and I'm sure she helps out a bunch of you guys. Let's get this started. Danielle, Russell, thanks for joining us today. Much, much appreciated. So excited to have you both. Before we really dive deep, I think we got to do a little bit of an intro on Dr. Belardo, where she's from, where she trained, that kind of thing, to introduce yourself to everybody.
Cool. All right. Well, great to be here. Thanks for having me. Great to meet you, Russell. I'm Danielle Belardo. I'm a cardiologist. I focus on cardiovascular disease prevention. I did my medical school at Drexel University College of Medicine in Philadelphia. Then I did my medical residency at Temple University Hospital in Philadelphia. And then I did my cardiovascular disease fellowship for 3 years at Lankenau Heart Institute in Philadelphia. So I'm from New York originally, but did 10 years of my medical training in Philly and then came out to work in the West Coast, which I very much love, 5 years ago. And now I'm a total transplant because now I can't handle anything under 60 degrees.
Yeah, I get so that. I just got back from New York and it was cold and it was only like 40. Russell, tell us about yourself.
Thank you guys for having me on here. My name is Russell. I'm a former athlete, and really I just want to advocate for, people that's going through this type of experience with cardiovascular disease and such. I'm also an entrepreneur, and I'm just pretty much trying to just spread positive energy and kind of just share my story and connect with people that can relate.
And I just heard you grew up in Boston, right?
I moved to LA, I think 2020, 2021.
Yeah.
And honestly, at this time, I just wanted a different experience. I understand the weather was definitely a factor, but I was just glad to be able to get out of my environment and try to see something different. So it was cool. It's been a great experience so far.
Doing something like that, just being able to just get up and be like, you know what, I'm out, I'm moving. Like, you had to have some kind of like goal or dream or something, right? I mean, did you move by yourself? Did you move with some friends?
So it's actually crazy. When I moved to LA, I told my mom 6 months before, I'm like, I'm moving to LA. And I think this is probably one of the biggest risks I took. But I'm the type of person who just goes out there what I want. And I kind of just wanted to pursue my passions there. The things I was doing in Boston in a different place. But initially, I was just going to go to school and I was thinking about going back into playing basketball. But I just wanted something different. Eventually, I ended up playing basketball at a college.
Which one?
I went to Bethesda University.
Awesome.
So it's a small Christian school in Anaheim.
Yeah.
And this was honestly the best opportunity I had to play basketball, really. My junior year was pretty great. And then my senior year, that's when, things started to get complicated with my health.
So you were hooping. What position did you play?
I was a guard.
Yeah.
I would say like I could play the 1, the 2. Sometimes they had me playing the 3, but I would just an aggressive person. I would just play hard, play defense.
Like, could you hoop though? Like, could you put it in the hole?
Yeah. Literally, I'll show you after. I'll show you some of my highlights.
Are you nice?
Yeah.
But then, like, and I know Danielle can appreciate this, you started having symptoms. Tell Danielle about the symptoms you were having.
So it's actually interesting because for some reason, something like my conscience was telling me to go get checked for some reason, because previously I had like a heart abnormality when I was younger, but I would get cleared and we didn't know it was anything serious. And typically I'd be able to play basketball, do whatever I got to do. I think it really started happening going into my senior year. I started to feel more tired. And I think that was the first thing that I noticed that kind of was just like, okay, something's not right. And then I get little palpitations. I don't know. For me, sometimes that would happen. I didn't know it was this severe. So it kind of just like started with that. And then it kind of just slowly progressed.
Gotcha. Now, as a cardiologist, if you heard somebody come to your office that was as young as he was, 22,
Yeah, 23.
what follow-up questions
Yeah.
do we have? What would you do?
I will say for age aside, I would actually say that, first of all, the most important thing, got to give you so much credit for listening to your intuition and really just saying, feeling like something's not right. And just, even though you are young, you're healthy, you're an athlete, you're like, still got to get it checked out. And I think that's really valuable and important lesson for everyone. regardless of specialty, because people need to, really listen to their bodies that way. But across ages, actually, what I thought was really interesting, the first thing that stuck out that you said is people do not realize that fatigue can be one of the presenting symptoms for a variety of cardiovascular diseases. So this can be coronary artery disease as people get older. This can be heart failure. This can be cardiomyopathy. This can be an arrhythmia. And oftentimes we have so many other reasons for feeling fatigued and tired. You're an athlete. You're a competitive athlete. You're in school. You're busy. You have a zillion other reasons to feel tired. So I just give you so much credit for noticing that you had something felt off, because oftentimes people, can really let fatigue just pass by as attributed to a variety of other things, when it really is a big presenting symptom for a lot of cardiovascular disease.
Yeah, a lot of physicians, at least in my experience, take advantage of youth. And so they, when they see a younger patient, they tend to almost dismiss symptoms at times and allow the symptoms to continue. So it's because they're young, right? And it's like, if a 75-year-old came in, you could do XYZ,
All the tests, right?
all the tests in the world. But because the person's 20,
Yep.
you're like, you don't need that, or meh, I don't. And I have kind of trained myself not to be that way.
Right.
Like, I'm a lot more invasive and aggressive the younger you are.
Yeah.
Because I want to make sure that we prolong your life. You were telling me earlier that you felt like physicians weren't listening to you.
Yeah. So initially, the first time I went to the hospital, it was weird because days before I knew something was wrong. I had an event. I do events, by the way. My event's called Born Ready LA, and it's a community event. And the first day of my event, I just knew something was wrong. I felt something in my chest. I almost passed out on my way there. 2 days later, I ended up going to the hospital, and I couldn't even see a cardiologist when I went. It was crazy. I'm not gonna say the hospital I went to.
Yeah.
I went to the hospital. I couldn't even speak to the cardiologist for whatever reason. I got misdiagnosed. They said I had hypertrophic cardiomyopathy. So I did my research on that. And then eventually I had another cardiologist, didn't really put me on the right medication. And then I found a better cardiologist who pretty much knew what was going on. He was advanced with heart failure. And from there, it was just a process of trying to get referrals and trying to figure it out.
Danielle, can you tell us what is cardiomyopathy, and really more specifically, the difference between dilated and hypertrophic cardiomyopathy?
Yeah, great question. So which one were you eventually diagnosed with?
Dilated.
Dilated,
Yeah.
got you. And he first told you it was hypertrophic, huh?
Yeah, he said, yeah.
Dang. Okay, so that's, it's tough. Both dilated and hypertrophic cardiomyopathy are genetic cardiomyopathy disease. There are versions of dilated cardiomyopathy that may not be genetic in origin, but a lot of them are. So oftentimes you can inherit a genotype, and have the genotype for this disease, and then develop what's called the phenotype, which is the actual expression of that gene. But sometimes some of these cardiomyopathies, both HCM and a DCM, can have no genotype, meaning there's no gene positive, but they're phenotype positive, meaning they present with the symptoms. And the issue is that oftentimes, so even though they're often genetically inherited, sometimes the parent may not have experienced the exact same phenotypes or the same exact presentation of the symptoms, so it gets missed in the family history. Quick question, anyone in your family have it?
It's genetic, yeah.
It's genetic, okay.
Yeah. I didn't find that until like later on.
Yeah.
But yeah.
Yeah. And so the difference between hypertrophic cardiomyopathy versus dilated. So hypertrophic cardiomyopathy is the one that often gets associated with athletes, that we worry about with sudden cardiac death. So oftentimes it's a thickened asymmetric septum in the heart, which is an area of the left ventricle. Technically, if it's above 1.5 is the measurement. And they can sometimes develop what's called the left ventricular outflow obstruction. So this is some obstruction from the left ventricle when it's pumping blood to the heart. When people have hypertrophic cardiomyopathy, sometimes, not all times, but sometimes it can progress where they have some fibrosis, scarring, and then what can happen is they develop arrhythmias. So the electricity part of the heart can start to cause extra beats from the ventricle and things like that. Dilated cardiomyopathy is, as you mentioned, it's often genetic, although there are some non-genetic causes. But this is when the left ventricle of the heart dilates, and it dilates significantly to the point where there can be a variety of different issues that end up with that. And we'll find out from you what you experience. Sometimes when it dilates, it can make the aortic valve very leaky. So people get something called aortic regurgitation because it stretches that valve of the heart. Sometimes when it dilates a lot, it can cause symptoms of ectopy, so similar to HCM where people can get extra beats. So they start to have arrhythmias, ventricular arrhythmias that can cause problems with the electricity of the heart. And sometimes they just have, really symptomatic heart failure. So the left ventricle starts to weaken in the way it pumps. And so for everyone listening, I'm sure listeners to your show are already very familiar with all of the anatomy and physiology of the heart, but the left ventricle of the heart is the part of the heart that pumps blood through the left ventricle, through the aortic valve, to the body, to the aorta, to the whole body. And usually a normal, what we call ejection fraction, this means the amount of blood that the left ventricle is actually squeezing out to the body, is normally at least 55%. When people start to develop heart failure, that means that less than 55% of the blood flow is being ejected to the body. And usually once it gets more severe, what we call, more significant heart failure for reduced ejection fraction is less than 35%. And then, the lower it gets, that means the less bloods that is coming out. And that's kind of heart failure in a nutshell. But they are two different etiologies. And so I'm so curious to hear about your experience.
You know what Danielle just explained, again, when you look at the wall here, you guys can see a picture of the heart. So when she was talking about the different chambers or so, it's as if you slice through and you open that heart up, you're going to see 4 different chambers on the inside of that heart. She was talking about the left side of the heart, which includes the left atrium, which gets blood from the lung that's already been oxygenated, that flows through what's called the mitral valve into the left ventricle. And then that left ventricle, which is the muscle, is going to pump that blood, like she said, up through the ascending aorta, up to the brain. Then blood goes back to itself through the coronary system and then to the rest of the body, your kidneys, your liver, your GI tract, all of that. And again, what she was saying is, listen, when you look at that muscle that you can see that the heart is actually made of, the muscle is doing 2 different things. On one end, the muscle is getting thicker, and so that chamber gets smaller in that left ventricular chamber. And then on the other end, that chamber is getting stretched out. And so when you stretch out that chamber, you're not just stretching out that chamber, you're also stretching out the area where the aortic valve is, which is why it becomes leaky. And so when all of that is taking place, whether it's hypertrophic or whether it's dilated, the result is less blood up to your brain, and people feel like they're going to, as you did, pass out.
Almost, yeah.
As we just explained, you started to develop those symptoms secondary to the alterations in the way that your heart physically was architectured, basically. And so you felt like you were going to pass out. Then you said a couple days later, you actually ended up in the hospital.
I think we had a basketball practice, and
You're still playing hoop at this time.
yeah, so this is
Unbelievable.
before,
Unbelievable.
Oh my
so this
God.
is
You're a tough
before,
guy.
this
Yeah.
is before I knew something, like, this is before I went to the hospital. So
But after you felt like you were going to pass out.
no, I was after
Okay.
that practice. So
Okay.
I had a practice, usually like it's my senior year, I'm keeping up, and then we're running. We do this run called suicide where you gotta go, it's called 17s.
Yeah,
Yeah,
where you're going back and forth the width of the court. Boom,
So
boom,
coach
boom, boom,
coach
boom.
was on, well, he made us do it 3 times.
Oh, that would make someone with
And-
a healthy heart pass out.
Yeah, literally everybody's tired, and me, I'm just like, all right, something's not right. After practice, I was so tired. I think the next day or 2 days later, I was going to work. That's when I almost passed out. And then, I had the first doctor misdiagnose me. Then I went to another doctor,
Misdiagnosed you was what?
hypertrophic.
Hypertrophic. Okay. But you knew you had a cardiovascular issue. So the doctor was able to at least key you in on, hey, listen, I think something's wrong with your heart.
Yeah, he didn't know exactly because he wasn't a cardiologist per se. But then I went to a cardiologist. He seen how young I was, and he kind of was just like, he didn't really, you know what I mean? He didn't really give me the best
Yeah.
care, I would say, because at that time my ejection fraction was 25%. That's significantly
Wait, so
low.
that doctor knew
I
your EF was 25?
found that out after the first time I went to the hospital.
Got
So
it.
when I was at
Because you had an echo in the hospital.
yeah, so they said, I remember, it feels like a movie. I went to the thing, whatever, doctors, and then he looks at me, and he's just confused. He looks at me, he's looking at the paper, and he said, your ejection fraction is 25%. So in my mind, I don't know what that means.
Right.
I start calling people, whatever, my mom, and my mom's actually a nurse, which is actually another thing too. I pretty much did my research. I actually got my records from, I had a visit with a cardiologist before I moved to LA, like 2019 or 2018. So I looked at that, and I saw my ejection fraction was 49%, and I didn't know that. So it's just like not understanding, about my condition and everything like that. Initially growing up, they just said it was just a slight abnormality, probably athlete's heart, but it was never significant. It was never something as to where like, oh, you can't play basketball. They just said we're just gonna monitor it. But turns out it ended up being a genetic pathogen. Like I said, I got the paperwork and I started learning about cardiovascular diseases, all types of, stuff. I got on Reddit. I connected with people that have the same condition, and I learned so much about like the medication I was taking. Like Entresto's a medication people with heart failure take. And I asked my doctor, like, hey, what do you think about this? Before I like really got sick, it was the summer. It was July, and I went to the hospital. At this time, I was just in such bad shape. So the whole past year, I was pretty much struggling, suffering, just in a situation where the doctors weren't really, taking it too serious per se. I saw Cedars Sinai, and I actually went to Marina Del Rey, because I was like, I need to see if I can get a better doctor, somebody who could really help me, because it's hard to do everyday things. I can't even walk up the street. That lady there, I think she really changed my situation, because she told me, she said, you're too young to be having this. And she said, she whispered to me, she said, you need to go to Beverly Hills. See your sign in Beverly Hills. Not even 2 days later, I woke up, I couldn't breathe. It was 4 a.m. And then I ended up going to the hospital. And turns out I went into, I think it's called cardiogenic shock. So in a way, my organs started failing pretty much. And that's, when everything, it got serious pretty much then.
Cardiogenic shock, for everybody who's listening, is a condition in which the left side of the heart is just not pumping enough blood to the organs, and the organs start to feel it. So your kidneys aren't getting enough blood, and so your creatinine goes up. Your liver is not getting enough blood, so your liver function tests go up. Your blood pressure is really low because that heart can't generate a blood pressure against that aortic valve. You get lightheaded. Sometimes you need medicine to keep your blood pressure up. These are things that I see every day in the intensive care unit. It's really funny because how Danielle and I actually met during the pandemic, during all of that craziness, until we were talking about, lung disease and ECMO and
ECMO.
it was, go ahead.
I'm this type of person, I'd say this to anybody who is newly diagnosed, like, do your own research, learn as much as possible, go to credible sources. Like, the thing that I think helped me is that I learned so much about the heart. I was correcting my doctors at times. Like, there was times they were like, oh, the highest ejection fraction is 85%. I was like, no, it's 55 to 70. And then he searched it up and he was like, oh, you're right. Like, I learned so much about the heart. And whatever condition you have, just do your research, because.
So you felt like for that time period, the doctors weren't listening to you. You weren't getting the care that you thought that you should be getting. And this is going to be a big question for you, because like there's a reason as to why I do this. Did you ever feel that like it was because you were Black?
Honestly, to an extent, possibly. I feel like it might have been that to an extent, but also not having as much support. Like, I was by myself. Like, if you see somebody come into a place and there's multiple people with them, more concerning, somebody's gonna obviously be more, wanted to take care of them. But when it's just me, they're kind of just like, So part of it was that, but I think part of it was also the lack of support in a way.
I just find it interesting that like, even when he was diagnosed with, he didn't have it, hypertrophic cardiomyopathy, nobody sat him in a tree.
And the thing that's really important, I think that you make a huge point. First of all, words can't describe as you speak, I'm becoming like overwhelmingly impressed with you, because you are such an incredible advocate for this. Because one of the biggest things I always say, and I know you say too, is that every patient has to advocate for themselves. This idea that as doctors, you shouldn't come to the doctor with questions or Google. No, you should be Googling. I have patients who will tell me that, when I prescribe certain medications like GLP-1s and things like that, patients that will say, I saw that I can get it for this price here on Reddit. Like, Reddit is actually can be a useful resource to kind of direct you in certain ways. Not saying that it's a accurate resource for everything, but I think your recommendation for people to advocate for themselves and look into every avenue and get the right care and not quit till you get that right care is just beautiful and so important. But one thing I think that I could be wrong, but that I'm kind of teasing out that seems like it happened to you, which I see so much, is that there's this breakdown that happens from pediatric cardiology patients to adult cardiology. There is this breakdown where kids go through, they may have a diagnosis. It may be a flow murmur or nothing, or it may be possible HCM or a possible cardiomyopathy. And there isn't, I think, enough of this explanation that you need to transition to an adult cardiologist. This is what the diagnosis is. This is how serious it is. People often are graduated from pediatrics, and then there may be years, there may be decades before they are, we find out they have a congenital cardiovascular disease incidentally, and they'll be like, oh yeah, when I was younger, I had X, Y, or Z, and I'm not sure what it was, which is really common. And there's this huge drop off. So it's tough, right? Because oftentimes when you're a kid, you don't know what's going on. I mean, I never even heard of these things when I was a kid. Then also for the parents, it can be tricky too. So it's tough. I think that if you're someone that's 18 and you've been seeing a doctor for a specialist for something, you don't need to know everything about it, but just know that you should find that version of that doctor as an adult to keep that continuity. The patients, the sad thing is that the patients shouldn't have to be doing all of this advocacy. There should just be a natural, clean transition to adult care. But I see this happen all of the time. And it's incredibly stressful. And I think that the reason why you're here with us today and you're, doing so great is because you did advocate for yourself and bridged that gap on your own.
The doctors didn't think I was going to make it. Literally, the person I was with, she was telling me that's what they said, because that's how bad it was. So I think just me having a second chance, like, why not share information? Because it's somebody who's out there and could pretty much use my story to kind of prevent the situation. Like, I wish somebody would have told me about this. And I honestly personally think that all athletes should get tested. It should be mandated that, I think, starting at the high school level, you should have to see a sports cardiologist and get cleared to be able to participate. Because like you said earlier, athletes are dying, just passing out, and it's just, people are too young for that to happen.
It pleases me to hear both of you talk about communication in this manner, because literally what you guys are talking about, when you're talking about the handoff from the pediatric cardiologist to the adult cardiologist, you're talking about the health exchange of information as people are evolving throughout their own life, right? It's the reason why we do this podcast. The reason why we talk about this is this doesn't just happen in cardiology. I mean, this happens in pulmonology as well. I mean, how many adults do I see that had asthma as a kid? Right. And then all of us, they think it just went away. It doesn't go away. Right. You still have it. Right. So they end up in my office. They're like, oh, when I was a kid, I was in the hospital all the time. And I was like, you're 30. Like, you're talking about when you were 22? Yeah. And I'm like, well, bro, I was only 8 years ago. So and what advocacy does is it just reminds us. And so I really, really hope that first doctor you saw, or that first cardiologist that you saw, I really, really hope that they got relayed the information of where you are today, because it will make them a better doctor, and they will listen to their patients, more. And I'm not saying I'm perfect. I know you're not saying you're perfect. I mean, I am just simply saying that when a 20-year-old comes into the office and they've got fatigue, you got to pay attention.
Right.
You really got to pay attention.
And that's the other thing too with heart failure, specifically for younger kids. So one thing we learned, when I trained, I trained at a transplant center, and when I was at Temple, you had a ton of heart transplants, LVADs, everything. And, one of the things my attendings drilled in my head is about not diminishing younger patients and their symptoms, because a person that presents with an EF of 25% in their 70s may be floridly volume overloaded with tons of fluid and with end organ damage and all of these things already. Young people compensate. Their bodies fight back and compensate. So oftentimes they can be operating at a low EF for years and actually having no idea. And sometimes the only symptom is fatigue. I'll never forget one of my attendings on rounds. There was a patient in their 20s that came in. Their only presenting symptom was that they had persistent sinus tachycardia. That was it.
Wow.
Persistent sinus tachycardia. And he said to me, don't ever, ever, ever ignore persistent sinus tachycardia. Sinus tachycardia means the heart rhythm is coming from the sinus node, which is the normal node of the heart. And the heart, the electricity is conducting normally. It's just faster. And we all go into sinus tachycardia when we're exercising, when we're stressed, when we're doing things. That's normal. But to have persistent, just at rest, your heart rate's 120, 130 in sinus, he said to me, it's never normal. That can be the only presenting sign for someone with, cardiomyopathy. And it's because young people compensate. Their body compensates and fights back so much that they can just go, go, go until they can't.
You get diagnosed with dilated cardiomyopathy finally.
Mhm.
Take me through your life then, because there's some other events that have happened to you ever since, and we're going to get into what recently happened to you. But tell us kind of the progression of your symptoms and where you are now.
So I remember a doctor I went to, he was like, you have congestive heart failure. And that's when it hit me, like, I was like, damn, like, that's because I was still learning. But when he said that, I'm not gonna lie, I think I was 23. I was very scared. Like, being that young and having heart failure.
Were you
Like,
by yourself in that appointment?
yeah,
Oh.
I was by myself. And it was probably one of the most scariest things, because I didn't even know what to do. I personally, I cried a lot. I felt just, and I had to leave everything. So at this
Who'd
time,
you call first?
I think I called my mom, actually. No, I think I called my dad, actually. I found out it was a genetic thing. So it was just so many emotions, I'll be honest with you. And I'm glad to be doing better now, like mentally, emotionally, physically. But initially, I just didn't know what to do. And I was in disbelief, because here I am about to start my senior year of basketball. I'm a captain. And then I just couldn't, it was hard to process. And then what I did was, at the end of the month, I ended up moving back. I moved to Miami with my mom. So I had to just drop everything I was doing. And I saw my physical condition just deteriorate. Like, literally, I was becoming like so just unable to just do normal stuff. Like, going to walk maybe 10 feet, it became a challenge. So I was in Miami for about, I think, 8 months. And between that time, to be honest with you, I really wasn't doing anything with my life. I didn't know what to do. I didn't have good doctors at the time. I was trying to find a specialist. I was trying to figure out what to do. And I spent a lot of time just every day. I didn't do anything, to be honest. And then I don't remember what happened. I think one day I just decided that I'm going to just do something with my life, because my mom was even kind of feeling kind of bad for me too, because I'm the person that's always hustling, doing something. She's not used to seeing me just, down, because physically, like, I'm feeling terrible. So she's not used to seeing me like this. So it kind of took a toll on her, even my brother, but they didn't really know. They couldn't experience how it felt. So it was just more of just the physical aspect that was just wearing on me. But, whatever happens, happens. I'm gonna be honest, I accepted the fact that I could die, because it was what it was. And then I rolled back into my classes. I finished that a couple months later, started getting back into events. I just started just
Pushing it.
I was still quiet about it. Nobody really knew about it. And then eventually, like I said, I went to Cedars, and that's when.
Hold on, but you lived in Miami for 8 months. So you're in Miami, and then you moved back to LA? Yeah. So, like, you got to tell me, like, I need details. I want, because you're in Miami at home with your mom, getting back into events, starting to do things. You're like, you know what? I'm going to do something. And you're like, fuck it. I'm going, right? So you going in, right?
So literally what happened was, I graduated in June, and I'm tired of living with my mom. I'm like, you know what, Mom? I told her, I love you, Mom, but I can't do this. So I ended up moving to Long Beach. I got a little studio, and then I started doing my events again. And to be honest, at this time, like, I'm trying to get disability because I can't do nothing. I can't really work. The only thing I could do was do my events. That's how I was supporting myself. And it's what I'm doing now as well. I got an event coming up in May. So if anybody want to support me, man, come to my event. You know what I mean?
What's the name of your event in May?
Oh, Born Ready LA.
Born Ready LA?
It's cool. Born Ready Films. We might have to do a collaboration. It's a dope event. We're gonna have artists, different small businesses. It's gonna be a dope event. I might even perform the song. I used to make music. I don't do music no more.
Okay.
But honestly, it's gonna be dope.
So you came back to Long Beach. You got a studio.
Yep.
You're still symptomatic. You're trying to get disability.
Very symptomatic.
Very symptomatic. And then what? You just were like, man, I got to go to Cedars one day. Like, what happened?
So I think at this moment, I'm so symptomatic. Like Jefferson will tell you afterwards. He was with me day to day.
When you say really symptomatic,
Mm-hmm.
give me the top 3 symptoms that you had.
I like literally I would just lay on my couch. Like I wanted to do stuff so badly, and I was working on my events. Jefferson would come with me, and I just physically was
You short of breath?
yeah, very short of breath. My chest felt heavy. I was tired. Like just doing normal tasks, it felt so difficult. I never want to feel like this. Like I'm grateful to be where I'm at now health wise, but like it's something that I wouldn't wish on anybody. Like I can't even explain.
And here's what everybody really needs to understand about the heart. So when you guys look up here and you guys can see the heart, you guys can see the lung. You got to remember that the heart sits in the center of your chest, and the right side of the heart collects blood that's already been used, and it pumps it to the lung. When it pumps that blood to the lung, as you take your deep breath, you're taking the oxygen out of the air and you're putting it into your bloodstream and onto your blood cell. That's what your lung is doing. And then your lung pushes that blood on to the left side of your heart. So if you can imagine this for a second, if the left side of your heart isn't functioning appropriately, meaning it's not pumping anymore, it's not pumping as much blood, that volume of blood still has to stay somewhere. So you get a backup. But remember, on that left side of the heart, where did the blood come from? It came from your lung. And so if that blood is backing up into your lung, we call that pulmonary edema. So you got all this fluid in these air sacs of your lung. So your lung can't do its job. And so because your lung can't do its job, and that oxygen can't sip through that fluid and get into your bloodstream, you get really short of breath and really fatigued. And other things can happen too, right, Danielle?
Yep, absolutely. And then sometimes when the ventricle we were discussing dilates, so when it starts to stretch out, sometimes the electricity that makes the heart pump, so we have electricity in the heart, that makes the heart pump and squeeze. And sometimes when it dilates, it stretches out the tracks that the electricity goes through, and it can cause abnormal electricity. So sometimes people feel palpitations, meaning their heart skipping. Did you ever have those?
Yeah, like atrial fibrillation. Yeah.
Yes. Yep. You
Yeah.
got it. Like atrial fibrillation, that's extra beats from the top of the heart. Then there's the ventricular ones, which are ones from the bottom of the heart. So sometimes sometimes they don't feel them at all and they have tons of these extra beats, but sometimes they feel them a lot. And so it sounds like you are having all of the symptoms that we very much know are associated with heart failure.
Yeah.
When you went to the hospital, if you don't mind me asking, were you, when you went to Cedars, were you in cardiogenic shock?
So I remember, what's crazy? When I first went to Cedars, I just knew that this was it. Like I knew for some reason, I was like, man, like I just knew they were gonna figure it out.
You're in the right hands.
So even in the lobby, there was some woman walking out and she was like, this is the best hospital I ever been. Like, cause they literally was like, you know what I mean? So when I went to Cedars, the first night I went there, it was 4 a.m. I just was having trouble breathing, and I was like, you know what? I gotta go somewhere. And then I went, I checked in, and they did so many tests. Like this isn't an ad, by the way. I'm just being honest. Like when I tell you they did like 15, 20 tests, and the other doctors did maybe 2 tests,
Amazing.
I was just like, wow. To be honest, if I didn't go to Cedars, the doctors told me I wouldn't have survived.
And
'Cause
Cedars is, I
yeah.
believe they're still the number one heart transplant center in the country. And correct me if I'm wrong, but that is one of the best places to go in the world. I'm so glad you knew to just push forward.
Did they say that to you? Did they say if you didn't come to Cedars, you would have been
That literally, because what happened was the next day I went to cardiogenic shock, and some of the other hospitals don't have as many machines and resources.
This is after you came back from Miami, when you went to the hospital at 4 a.m.
So I went to the hospital in October.
in October of 22.
No, this was 24.
Oh, this is
It's
just last
recent.
year. So you went to the hospital in October of 24.
What, 4 months ago?
Yeah.
Yeah.
Well, yeah. You was to the hospital October of 24. You get admitted. The next day, you're in cardiogenic shock.
What happened? So it's crazy.
Tell me.
I don't remember anything. All I know is I couldn't, I was getting pale. I couldn't feel anything.
Oh, yeah.
And all I remember is there was like 10 doctors that would come in the room, and that's how I knew it was serious. And I'm like barely cognizant of what's going on. My friend was with me crying and everything because they didn't think I was going to push through. And then I think I had to do with the Impella.
Yeah.
I had to do getting the Impella.
Hold for a second. What's Impella, Danielle?
So the Impella is like a temporary LVAD that is used just temporarily when someone's in cardiogenic shock. that helps to offload the left ventricle, meaning take some blood from the left ventricle and distribute it to the body when someone has heart failure. So when that left ventricle is not squeezing the blood appropriately to the body, you can offload it so you can get some of that blood out of the left ventricle and be able to distribute it to the body. But it's temporary, and it's something what we sometimes see in cardiogenic shock.
So
Yeah, so when the heart doesn't work, you give it a little machine, and the machine pumps the blood.
so yeah, then got that, and then we're trying to get a heart. I think I was status 2. I wasn't able to get a match, which is when you get a heart transplant, there's a bunch of different factors like blood type, size, weight. So they want to give you a perfect match because it's a heart, it's a serious procedure. I wasn't able to get a match, and then we went and got the LVAD.
Now it's time for What's the Buzz, presented by BuzzRx. Every week, I answer a health-related question from one of our viewers. This week's question: how do doctors decide when to adjust or switch heart failure medications? Is it based on my symptoms, test results, or just their gut feeling? Heart failure is systolic when your heart is squeezing, or diastolic when your heart is relaxing, dysfunction resulting in your organs feeling like they are not getting enough blood. This leads to edema or fluid collection in your legs and throughout your body, and can also lead to fatigue. I see a lot of these patients due to pulmonary edema or fluid in the lung, leading to shortness of breath. Heart failure patients can be on a number of medications, including beta blockers, ACE inhibitors, potassium-sparing diuretics, and other diuretics. There are even newer heart failure medications like neprilysin inhibitors, which are combined with ARBs to manage heart failure. The way I manage in pulmonary clinic is quite simple. Since I know people gain weight when they develop edema, I ask my patient to remember their weight when they are feeling their best. If they gain 5 pounds over several days, it's likely all edema. I simply tell them to double their Lasix diuretic dose to increase their urine output, which eliminates edema and gets them back to their dry weight. Pretty simple. That's the buzz. If you have a question, email us at healthexchangepodcast@gmail.com. Thanks again to BuzzRx. Look up your medication on buzzrx.com or the app to see how much you can save. So, Russell, it's October of 2024, 5 months ago, 4 months ago. You're admitted to the cardiovascular intensive care unit in complete cardiogenic shock. You don't remember anything. You are literally, and I'm not saying this to be dramatic, I'm saying this to be very serious. You're on death's door.
Yeah, literally.
Right? You're 24 years old, right? On death's door with cardiogenic shock. You get an Impella device. You're put on the transplant list. All of this is happening. You don't remember probably half of it. But when you actually come to, and you're alert and you're oriented and you can kind of interact, what is going through your mind?
It's crazy because I still don't feel like I'm the same person in a way. Like everything that I'm experiencing now feels new to me again. Even going out in public. The other day I went by the hospital, and it was weird because I wasn't in the hospital, and now I'm able to go do normal stuff. I would say when I was in the hospital, I was glad that I was finally getting care, that I needed. It was just unbelievable to really process, because I think once it finally got to that point and I went on social media and posted about it, I really posted about it because I just had to spread some type of awareness, and I just had to, I had to get it out, and luckily I got a lot of support, and it was just really a shock. Like a lot of people that I knew, I'd never gotten so many messages ever. So it was just a thing as to where I was just processing and navigating it, trying to be positive. My body was in a lot of pain. Like that's a whole nother topic, but when your body's going through that much stress, it's just I felt a lot of different pain. It was just a lot, but I was just trying to process it, being as positive as I can. And I think for the most part, I just came to terms, and I was happy that I was in the right place per se. I didn't want to be in the hospital, but it's better than, being alive than,
And I'm
not
sure
being alive. So
your mom came, your mom showed
yeah,
up, right?
mom, dad, brother.
And you had the Impella, and then did you immediately go from the Impella to the left ventricular assist device? Is that what happened?
So what had happened was they were talking about the LVAD, and I already knew about the LVAD. I did so much research, and I personally was opposed to it. I remember my doctor, he became a cardiologist because I think one of his closest friends had hypertrophic and passed away. I seen him yesterday. It was great talking to him. He came in, he was telling me, long term, this might be the best thing. you know, because the Impella, you can only be on there for so long now, and then you got to get the LVAD. So I was very opposed to it. I didn't want to do it. I wanted to see if I could stay longer
When you say stay longer what?
on the Impella to see if I can get a heart.
Oh,
So
so you're an inpatient still. You're still in the hospital.
yeah, so I didn't want to do the LVAD, but then, you know, I had to pretty much just look at things, look at the bigger picture. I think for me personally, it took me some time to accept myself, because now being in this position, I have a device.
Through the HeartMate 3.
Can I show everybody? For people that probably never seen this before, this is what it looks like. You got a controller right here, and you got batteries, you know? This is HeartMate 3.
Yeah. Oh, it is a heart rate.
So
Okay, cool.
fully charged right now.
Amazing.
And then you got the controller. So this has, you know, all the different settings on it and stuff, information.
Yeah.
But yeah, so I was very opposed to it. Let me put this back in the thing. I mean, looking at it now, I guess it's just a part of me. So I personally don't feel any type of way about it. I'm just glad that we have this type of technology.
Danielle and I were talking about this, this morning. We were talking about LVADs. We both have experience with it inpatient wise. We both have experience with it outpatient wise. We don't do it every day, right? People with Cedars, they do it every day. But essentially, how does it work?
So HeartMate 3, so I'm not a transplant specialist, but I do have, or heart failure specialist. I'm a preventive cardiologist, but I do have patients that I refer to Cedars all the time because they are truthfully the best, I believe, in the world for this exact reason. So an LVAD, a left ventricular assist device, this is a device that Russell has that essentially is helping there's inside his heart, there's a cannula, there's a device that takes some of the blood from the left ventricle of his heart, where we were talking about that area that is not squeezing as much blood out as we'd like, and it offloads it essentially to the aorta, which is the vessel outside of the heart that gives blood to the rest of the body. Then it's connected, it's powered, right? Because it's not based on, the sun, it's based on actual energy. It's a charged device. And so you have something called a drive line, where this is, I see his drive line right there, and that's what's connected to his pack, and it goes into the body to power the device. The HeartMate 3 is a phenomenal device. Actually, things have changed, a lot in LVAD. The HeartMate 3 is a really sophisticated, incredible device. It has less risks of, pump thrombosis. That means when there's clot builds up in the pump of the LVAD, or various different kinds of risks. And it's a much better device than, we've ever seen before. And the reason why people have LVADs, there's a few reasons. Some people get what's called a destination therapy LVAD. That means they get the LVAD, they may be older, and for whatever reason, they are not a transplant candidate, which can be for a variety of things. People with certain kinds of malignancies sometimes aren't a transplant candidate. Maybe they're too frail, too old, and they can get a destination therapy LVAD and live with it for years and years and years and do phenomenal with it. Then we have bridge to transplant, which I'm sure you may be in that boat. Some people get a LVAD where they are using it in the temporarily interim until they find that heart transplant that's the right fit for them. Because actually, you so brilliantly said, it's complicated heart transplant. We don't just take any heart and put it in any body. You want a heart transplant to succeed. And the most amazing thing I've seen in cardiology over the last, since I started med school in 2010, is how phenomenal heart transplant is now. I mean, people get heart transplants and live decades with their transplant, doing really well. The medications have changed. The entire way that they do immunosuppression has changed. People do phenomenal on heart transplants. So since LVADs are such a great way to keep a person doing great like Russell is now and keeping him healthy, because we want to keep that individual really healthy so that way his body's healthy, his bones are healthy, his muscles are healthy, his lungs are healthy. So that way when he goes and gets his heart transplant, that heart's going into the healthiest, fittest body it can and the right fit. So it's really been a magical change in cardiology having a phenomenal device like this, because it gives enough time for people to match the right heart with the right patient and, set you up for success and also allow you to feel a lot better in the meantime.
Just like Danielle said, LVAD stands for left ventricular assist device, and you're just taking blood that would normally be pumped by the heart, and you're letting the machine pump the blood up to the brain through the ascending aorta and then to the rest of the body. sometimes there are consequences from having one, right? So he's basically got a wire that's going through his skin into his ventricle, and the skin has bacteria on it. So you got to make sure that it doesn't get infected, right? Skin infection can happen. Sometimes that driveline can get infected. I've seen it happen. I remember it in residency and fellowship. That can be an issue. So you make sure that person doesn't have that. Danielle already mentioned the blood clots can happen. So he's on a blood thinner, right? He takes a blood thinner every day to make sure his blood is thin enough so it doesn't pool and clot. Because if it clots, one of the other consequences of it is that clot can go through that line up to the brain and you get a stroke, right? Because a stroke is essentially a heart attack of the brain. It's just a clot of some of the smaller vessels in the brain. And when that happens, your brain starts to die out, so you can get a stroke. And then the other issue is aortic insufficiency can be worse with an LVAD too, right?
Yeah, and also the other concern long term, most notably, is the right heart. So, when you have left side of the heart's getting supported, the right side of the heart could sometimes be strained. So I'm sure that you get tons of checkups and they're constantly evaluating how both sides of the heart are doing. Is yours a bridge to transplant? Is
Mhm.
that kind of the plan
Yeah.
for you? Yeah, I'm just so impressed with you. You're doing all the right things. You're out and about. You're leading that healthy life, and I'm so I'm so happy for you because when I see heart transplant patients, I actually have several, and they all go to Cedars, and every single one of their positions is amazing there for their transplant, and they do so great. Heart transplant it's a new world, and I think that you're preparing yourself to be the healthiest vessel for that new heart you get one day.
Yeah, I mean, before this, I was an athlete. I was very healthy. I was always
Yeah,
working out, doing the right things.
it's a part of you.
Yeah, like even I like being active, and I'm just glad to be outside and doing things again and going from point A to B. Another thing is just everything happens for a reason. I think the biggest thing for me, I questioned like God, I questioned everything, but I feel like it's part of my purpose to use my voice. I didn't necessarily want to be the advocate for this, but I had to sit down and think and come to terms with it and realize like what I'm really doing. It's not just about me. It's a lot of people out there in the world that have this condition and are afraid to talk about it, you know? And if I could talk about it and show people that you can still live your life, I guess I'm disabled, but mentally I'm able. I could still do everything the same. I could think the same because there's people in the world that are physically good, but mentally they're not able to execute. So it's like, I feel great. I'm glad to have a second chance, and I live my life every day as if I had a year left, what would I do? You know?
That is
So
a interesting way to put it.
like if you had a year left, you would do as much as you possibly can. You try to enjoy it. So my whole perspective on life is definitely different. I value time more. I value relationships more, and I just value like purpose. Why am I doing this? Why am I with these people? And I'm just glad to be here because I personally, when I was in the hospital and everything and recovering, man, I've never felt like that, and I never want to feel like that again. I'm just glad to get back to this point where I feel like like a normal person again.
And I think it's also important, you're in the best place, you're in the best hands, you have such a good attitude. And I think it's important just to hear from doctors on the other side. Like for me, I see my transplant patients that, even though I'm not a transplant cardiologist, but I see them for other reasons and I share them with their main physician is their transplant physician. But I see these men, women living their lives doing so well. And I think it's important for you to know and for people out there to know that transplant has changed so much. It's people live decades. I think the oldest heart transplant I saw when I was a resident, and I'm sure at Cedars they have even updated numbers here, but at Temple, the oldest heart transplant I saw was 22 years,
Mm.
which is amazing. He had this heart transplant 22 years. He was doing phenomenal. And so I think that you have a beautiful future ahead of you and you're going to be helping so many people in the process.
The longest one was actually 39 years.
39. Can you
Yeah, I forgot who it was. And then there's a guy who ended up playing professional sports. It's something Smith. He had one and he had it for I think 33 years. He just got a second one.
amazing.
He's an advocate as well. I can't remember his name, but he had a heart transplant and played professional soccer, which
Amazing.
is crazy.
That is great.
Amazing.
Yeah.
Hearing the words heart transplant, and knowing what kind of person you are, who's looking up things, doing your own research, have you done your research and are you doing research on what that life is going to be like, understanding that, the postoperative course, understanding the immunosuppression.
Yeah.
Are you thinking about all of those things as well?
So I think that's the biggest thing that I was concerned about, because you want your heart to last as long as it possibly can. People often tend to have multiple transplants depending on their age and such. Obviously, medicine is changing, so I assume that hearts will last longer
And you
as
know what else
time.
too? The other
Yeah.
thing too, it's really important that people forget. So the reason why I see also transplant patients, even though I'm a preventive cardiologist, is because after you get through the acute phase of concern for rejection, like the first year, then the first 5 years, the actual main cause of the graft failure in the vasculopathy in the actual donor heart is coronary artery disease, which is the #1 cause of death for men and women without a heart transplant, right? So once you get out of the rejection kind of zone, then the same risk, a lot of the same, risk factors that can cause coronary disease in the general population, high cholesterol, high blood pressure, diabetes, elevate the risk of the coronary arteries, the arteries that lead the blood flow to the heart, to have those kind of end up getting plaque buildup and things like that as people age. And so, post-transplant, it's besides the immediate acute several years where you're looking at, of course, trying to prevent the graft from, the heart from rejection, because the body, you don't want it to attack it and think it's because it's a foreign organ. But outside of that, then it's more like long-term, really just living a lot of the healthy lifestyle that you would be doing anyway. And I think that because preventive cardiology has changed and the amount of medications we have to reduce cardiovascular risk as a whole, I can only imagine that's going to also translate to our transplant patients.
Yeah, 100%. So in other words, you're going to be seeing her after you get your heart.
Exactly. Well, I'll be sharing you with those Cedars docs. I'll be managing your cholesterol.
Yeah, no, perfect. Yeah, I did a lot of research on the immunosuppressants and the medication and stuff, and I know like you gotta kind of, you can't be around too many people for a certain amount of time. All
Right,
that.
in the acute period. That's
Yeah.
right. Yeah. So in the beginning, it's almost like you go through phases, and you know this from lung transplant. The beginning, is the immediate rejection they're concerned about. And then you go through kind of different phases. And then as you're like 5 years out, 10 years out, 15 years out, the amount of, concern about infection risk and things like that starts to change. Of course, the other thing is cancer screening. So people on immunosuppression long term are constantly screened for different kinds of malignancy, like skin cancer and colon cancer and things like that. But just being what you're doing, being on top of it, just being an advocate for yourself, not taking no for an answer, and trusting your intuition, I think, has been key in your amazing success. Listening to how you feel, following your intuition, I think, has set you up to be where you are today, which is, I think, on the trajectory to have things get better and better.
And you had a good center, because the center does a lot of transplant work. And, they do lung transplants, they do heart transplants, kidney, liver, like they do all kinds of transplants. So they really understand the transplant physiology and they really understand immunosuppression. Just for you to know, right? When you get somebody else's heart, because of the cells that are in that heart, there's a couple of things that can happen. One of the things that can happen is there are white blood cells in that heart that can start attacking your body. And then there are your white blood cells in your body that can attack that heart. That's what we're trying to prevent. That's what we call rejection, right? We don't want that rejection. As Danielle said when she was talking about coronary artery disease, which are the pipes that are carrying blood to the muscle of the heart. Some of those things, some of the white blood cells, when you have rejection, they're actually attacking the endothelium, and that can lead to coronary artery disease. And so the immunosuppression and calming down that process, not allowing it to happen, is paramount. It's extremely important.
Well, a lot of the coronary artery disease too is actually really the CAV, which is the reason for issues with transplant later on. They're like far many years out of the acute transplant rejection phase. A lot of it is, complicated. We don't have the exact answer, but multifactorial from the transplant medications or from, various factors from the immunology standpoint that integrate into that. But a lot of it is just based on the similar risk factors that cause coronary disease, which is why, you're kind of going to view it as the acute phase. You're going to have kind of year bench points. And you're going to be like, okay, year one, and then year 1 to 5, and then 5 to 10, and then each segment is going to take on its own new life. And I think that we can honestly both say that transplant in both of our fields has drastically changed over the last 2 decades.
Drastically changed. I mean, the thing that I love about heart transplants is hearing that those organs are lasting like 30
It's
years.
amazing.
Like, I mean, that is absolutely insane.
And
I mean, it's crazy. It's because the lungs it's less. But the reason it's less is because every single time you take a deep breath,
yeah.
you're introducing antigen into your lung. And so you're actually causing an inflammatory cascade. And when you already have a little bit of rejection building on top. So that's why the lung transplant numbers are less. You don't need anyone. Like, so we're talking about a heart, and you're doing your research, you're paying attention, your Cedars is going to make sure that you're well taken care of. So I'm sure you ain't never leaving LA.
We have the best team. I'm telling you, best team on earth.
No,
Yeah.
I think I'm gonna stay.
Russ, when you were at that point and you're by yourself and you're going through this, like what motivated you to have the energy to take that next step? Or what motivated you to get on that plane and come to LA and say, "Mom, I'm out." Like what was it? Like what was it when you were by yourself going through this?
You know, to be honest, I think part of it I was just a little delusional. I was like, you know what, whatever. But I think realistically, I just like to live life on my own terms. At the end of the day, you have your family, you got, you know, everything like that. But you have to do what you want to do. And I refuse to not live how I want to live. I just feel like if I don't like what I'm doing, I don't do it. You know, I'm a person who pretty much knows what they want. To be honest, I just decided that I just have to do something. Like, it goes to the point where, yeah, I may not be all the way there. I might not have the resources. I didn't even have the sponsorship to do some of the things I was doing. But I knew with whatever percentage of heart I had left that this is what I wanted to do. Going back to LA, I knew there was a better medical care. I was living in Florida. I just knew the healthcare was better in LA for, my doctors were there. The community I was building was there. In my mind, I'm gonna be honest, I didn't know if I was gonna live that long at that point. But I was like, if this is how it ends or whatever, at least I was happy,
Normally we end the show with what's called a positive pulse, and we talk about something positive that's happened in patients' lives, but like there's no doubt about it today, everything that you've gone through. And I mean, bro, you did this by yourself. You are strong as hell. Like, for real, to go through all of this like by yourself and to be able to advocate for yourself the way that you did.
Amazing.
To be able to get through everything, to know to go at the right time, to go to Cedars at 4 a.m. that day, going through cardiogenic shock literally hours later, getting the Impella, and then a month later getting, a bridge to transplant with the ventricular assist device. Doing all of these things at the appropriate time is all as a result of your intention with how you lived your life once you got diagnosed. And that day that you got up from your couch in Miami and you said, "Mom, I gotta go. Like, I'm doing this. I'm doing something." Like, that was the intention that was required for you to be where you are and for you to get to where you want to be. And so in my mind, in our minds, there's no doubt that you're going to continue to be successful. You're going to go through the heart transplant.
Do amazing.
You're going to do absolutely amazing. And you're going to advocate for so many people that are going through the very thing that you're going through right now. And I don't see a more positive pulse than that. If you had a 25-year-old person and they're alone and they're going through the exact same thing as you right now, what are the 3 things that you would tell them?
I'm still trying to figure it out myself. But I'd say the things that kind of got me through it was kind of just being patient, I would say. Understanding that, like, it's a journey that I'm going through. Like, I'm not going to be better tomorrow. And it's part of my story now. I think I remember a time I was leaving the hospital and Jefferson brought me, and I asked the doctor, because at this point, I didn't have a good doctor yet. And I was like, I just told the doctor, just be honest with me, man. Like, nobody's been transparent. He told me that he thinks I'm going to need a transplant. That's what he told me. Leaving the hospital, I was sitting in the car, Jefferson was driving. I was just tearing up, straight face tears. But I was just like, and Jefferson told me, actually, he said, "This is your story." And we were just quiet for like 40 minutes driving. And I think just having a little bit of support, even my mom, telling me, texting me, like, "You're going to be okay. You're going to get your life back." She was always texting me because she believes in me as well. I just knew that this wasn't the end of the story. I just got to just navigate it, because as long as you're breathing, as long as you're waking up, you're in the game. You know what I mean? If you're not breathing, obviously you're not in the game. So as long as I'm breathing, I have opportunity regardless of where I'm at.
Russ, appreciate you being here today. I mean, I think there are a lot of key takeaways. What are your top 3 takeaways from today?
Just advocate for yourself. That's number one. Like, nobody really knows how you feel, so only you know how you feel. And sometimes you gotta make tough decisions. Like, you gotta look at yourself and know something's not right. So advocate for yourself. That's number one. 2, I think just in general, I feel like just be present. One of my biggest problems that I had was I feel like I was so worried about so many things that didn't really matter. And then when I got in this situation, I started to realize what really matters. So prioritize, yourself, family, things that matter. And 3, just enjoy it. I'm never going to be 25 again. I'm 25 now. I'm never going to be 25 again. So just live your life, enjoy your life, enjoy, where you are now, where you are, because, time is just going to keep passing. And I don't know, maybe just do what you want to do. Like, don't be afraid to just pursue what you want. I think that's the biggest thing. I used to worry about what other people think about me, my parents here, friends, whatever. But at the end of the day, do what makes you happy, I guess.
Danielle, what do you think?
I think that, every single person, whether or not they have a heart condition or any medical condition, or anyone that's young and healthy, can learn from what you just said. All of us in every age and every stage of life can learn valuable lessons from your advice. And I want to thank you so much for sharing it with us.
Appreciate it.
Russell, you got an event company, it sounds like, and you got events coming up. Tell us about your company and about your next event.
This event, the reason why I started this event personally is because when I was in Boston, I felt like there wasn't a platform for creatives to come. We always have the super big people that are famous, like Chris Brown, Kendrick Lamar, whatever. But there's a lot of smaller brands and artists that don't get a platform. So that's what this is for. So if you're an artist, if you're a small business, if you're a creative and you just want to be around a supportive community, this is the perfect event for you to come to.
What's the name of it?
Born Ready LA. Well, really Born Ready Worldwide. Next event, I think it's going to be in May. And then I got some coming. I'm going to go back home to Boston in July, do an event there. But yeah, Born Ready Worldwide, Born Ready LA. Follow us there for updates.
I thank both of you for being here. Danielle, thanks for coming. Much appreciated. We got a great positive pulse from Russ and what he's been through the last 2 years and even the last 4 months, really. If you guys want to support Russell, like I want to support Russell, we're going to put his GoFundMe page in the show notes. But please, if you want to support him on his GoFundMe page, it'll really help with his medical costs as he continues throughout this journey. I want to thank you guys for watching The Health Exchange. We're on Instagram at The Health Exchange Podcast, and we also are wherever podcasts are found on Spotify, Apple Podcasts, iHeart, and YouTube. So get us every Thursday morning at 6 a.m. Pacific, 9 a.m. Eastern, and we'll see you next time.